Good afternoon. Today, I want to talk with you about something very important. We all drink something every single day. Water, tea, coffee, juices, and often we think, well, how harmful can a drink really be? But the truth is, the beverages we choose have a much bigger impact on our health than most people realize. When we're young, the body forgives us a lot. A soda on a hot day, a strong drink in the evening, even an energy drink after a sleepless night. But after 45, every one of these choices starts to matter more. The heart, the vessels, the liver, the stomach, they react much more strongly than they did 20 years ago. That's why today, I want to share with you the 3 drinks that as a doctor, I recommend you avoid, or at least reduce as much as possible. And I'll also explain the why, because when you understand the reason, it's much easier to change the habit. The first one is soda, colas, lemonades, flavored sparkling waters. Let's break it down. 1 glass of soda can contain 6 to 8 teaspoons of sugar. Imagine putting spoon after spoon into a glass. Would you eat that much sugar? Probably not. But in liquid form, it gets absorbed almost instantly. What happens in the body? Blood sugar spikes very quickly. The pancreas has to release insulin. Within 20 to 30 minutes, sugar drops again, and you crave something sweet. This creates a vicious cycle. And after 45, it becomes very dangerous. Why? Because insulin sensitivity decreases. Metabolism slows down. Regular sugar spikes can push you toward prediabetes or type 2 diabetes. And there's more. Sugary soda overloads the liver. It starts storing fat, especially around the abdomen. And this visceral fat is the most dangerous type, increasing your risk of heart attack and stroke. And don't forget, soda doesn't actually quench thirst. You drink it, and 15 minutes later, you want more, which means more sugar, more strain on your body.
The second drink is strong alcohol. Vodka, whiskey, brandy, and similar spirits. I often hear from patients, "Doctor, what about just 1 glass for appetite?" Well, let's look at what really happens. After 45, the liver can't process alcohol as efficiently as before. Every drink is a heavy burden. Alcohol raises blood pressure, irritates the stomach lining, and stresses the nervous system. What's even worse, it destroys quality sleep. Yes, you may fall asleep faster, but the sleep is shallow. You wake up tired, heavy-headed. And chronic poor sleep is a direct road to hypertension, a weaker immune system, and memory problems. And don't forget the calories. Alcohol is loaded with empty calories. Just 100 milliliters of strong alcohol can equal the calories of a whole snack. And weight after 45 doesn't come off easily. The third one I want to emphasize is energy drinks. Yes, they give a quick boost, but let's look at the cost. They're packed with caffeine, sugar, and chemical stimulants. That's a direct hit on the heart and blood vessels. Blood pressure rises, pulse accelerates, the body is under stress. If you already have high blood pressure, arrhythmia, or you're simply more tired than before, energy drinks can trigger serious problems, from a hypertensive crisis to a heart attack or even a stroke. And the most frustrating part? The effect is short-lived. First comes a spike of energy, then a sudden crash. You feel weakness, irritability, anxiety. It's like borrowing energy from your body, but paying it back with interest. Avoiding is good, but replacement is even better. Number 1 is always water. Pure, still water. Every cell in your body needs it, and most people simply don't drink enough. Herbal teas are wonderful. Chamomile, mint, lemon balm, rosehip. They calm the nervous system, support digestion, and put no strain on the heart. Homemade fruit drinks, sugar-free compotes, or just warm water with lemon are also excellent alternatives. Coffee and tea are okay in moderation. Just don't let them replace water. So, the 3 drinks to avoid after 45 are sugary sodas, strong alcohol, and energy drinks. They don't give real benefits, only the illusion of pleasure or energy, while quietly harming your heart,
vessels, and liver. Try cutting them out for just 1 month. Replace them with water and healthier choices. You'll notice mornings get easier, energy stays with you longer, blood pressure stabilizes, and sleep becomes deeper. Remember, health isn't about strict bans. It's about smart habits. Small steps every day lead to big changes, and those changes bring us a longer, healthier, and more active life.